we go. This is the Our Town with Troy By, and sitting across from me, well, I'm going to give you her given name, and then I think I may have permission to call her what everyone else calls her. But it's Mary Elizabeth Marr, and I believe Zane, that's how I met you through Zane Drost at Thrive, Alabama. They call you me Marr.
They do.
And some people also just, I think, call you Marr. What's your preference?
Me Marr is actually my preference.
Is it?
The funny thing is that Marr, where that came from was that Senator Sessions could never remember me Marr. And so he would just call me Marr. And it was so odd.
This was up in D.C.?
Up in D.C. Mm-hmm.
Where's Jeff Sessions out of?
So we had Shelby.
Right.
And now that's Katie Britt. And we have Tuberville, who was Jeff Sessions. And
Yeah.
Jeff Sessions, I believe, really hails from Mobile. And he actually was a very big supporter of our things that we're going to talk about today. And because he felt that that Alabama was not getting our fair share.
Well, there is a great example. I was actually going to lead off this episode with something just kind of related to sometimes you just live life like ignorantly on things. But of course, I did just transplant here from Virginia about a year and a half ago, and arguably Richard Shelby gets all the attention. I think, just as far as in the defense industrial base, that's where I work.
Every
when I moved here,
university,
it was all
Shelby.
Yeah.
Every university has multiple buildings named after him.
Gotcha. So, I don't know why. I think I had Lindsey Graham and Jeff Sessions mixed up in my mind because I think Lindsey Graham's South Carolina.
Yeah, I think he was.
So you're the chief executive officer of Thrive, and I want to just provide a little bit of behind the scenes, and I've said this before. You know, sometimes I think in our language, there's not as many words as to convey really the way you feel about something. And if I said, I'm very excited to talk with you today, I'm super excited, right? Well, we say that all the time. So, but really, how do I feel about this, right? Well, I'm excited about all of my episodes, of course, but every now and then there's an episode that comes along and a guest that comes along where it touches on a little bit of my ignorance as a human being. And I think part of our lives is that we should always be learning and growing and progressing and getting better. And for me, part of that is the AIDS epidemic. I realized in meeting you, basically, I met Zane through his previous employer. He reaches out to me, says, "Hey, we'd love to have me Marr come on." Awesome. Yours is the type of thing. I don't know a lot about Thrive. I'm learning now that I'm here more about Downtown Rescue Mission and First Stop and the Manor House and all these things. I've had Wellstone. I've had these folks on the podcast, and every time I dive into learning more about stuff, but every now and then there's an episode that comes along where I realize, man, I don't really have. In this case, Thrive used to be the AIDS Action Coalition.
Correct.
Wow, I have never studied up enough on the history, if you will, the ugly history of the AIDS epidemic and what happened and this and that. And I realized that I never have known anybody, even in a family or friend or a family friend, that passed away because of AIDS.
Now that's unusual because I feel like every family is affected, not infected, but affected by HIV and AIDS, because we have so many people infected, and so many people at risk.
I want to say there's still 7 million worldwide that have AIDS and maybe
don't even know it,
and some percentage don't even know it.
Oh, absolutely. This year has been our largest new infection rate at Thrive, Alabama.
Really?
So we keep track of it every year, and we have people that come into care that have known they were infected for several years. They never really wanted to get care, or they have moved to our area, and they know that we do specialize in that. Or they just come because they have another issue, and we do an HIV test, and we find that they're positive, and they never expected that.
Right.
And that's truly so sad because, and we'll talk about this, we have tools in our toolbox to keep people from getting HIV. And it's not so much that people are dying of AIDS complications anymore. It's a pretty manageable disease, but the problem is it's so expensive. Over a lifetime, just taking medications and your every run-of-the-mill doctor's appointment is going to cost over $500,000 a person.
Oh, my goodness.
So if we can, on a humane point there, if we can keep somebody from getting HIV in the first place, but then on an economic basis, it really makes a difference.
Now, this may be way jumping ahead, but I'm assuming with that kind of price tag, you're not going to get, if you went to apply for new medical coverage or whatever, pre-existing condition, hell, I have HIV/AIDS, sorry, you're out of luck.
No,
Is that a reality?
That is one of the blessed, wonderful things about the ACA. Those kinds of things, they can't say, oh, you've got diabetes. I mean, there's lots of diseases that are expensive. Not so many that are as expensive as HIV and AIDS, but that could be considered pre-existing conditions. And the ACA doesn't go along with that.
Well, and I would say, I guess, thankfully, if this was the 1980s or 1990s, you'd probably be out of luck.
Yes, and you would have been out of luck in things like, well, and you still could be out of luck in life insurance policies and that kind of thing. But you can be out of luck in life insurance policies if you are obese.
Right.
I mean, they check out those things out and look at what is going to be a problem for you in the future.
Right. So, I think I really would like to start with AIDS, if you don't mind.
No.
And just, again, to give you a little bit of additional backstory, well, I was tested for AIDS, and I think it was around 1985. And it's funny because I can't remember anymore.
It's very early.
I was born with a blood disease called spherocytosis, and I had my spleen removed when I was 6. I had to be old enough to handle the surgery, but I couldn't wait too long or I would die because I was getting blood transfusions every 6 weeks. And so if you park it there, it starts somewhere around, 1981 or so, or 1980. There's these 5 gay men in San Francisco. And all of a sudden, then 5 babies show up in New York that have symptoms.
So if you want a really good historical book to read, The Band Played On is a great book that talks about it from the beginning. It was also a movie, and you would probably find it under the kind of documentary kind of movies. And it's it had every person, Lily Tomlin. I mean, I can't even, I didn't think up on that as one of your questions.
It's okay.
So it's really a great movie, and it shows you exactly what happened. So what happened was that the very first person in the United States that we know, and it has been, the CDC has looked into this forever and ever, was an airline steward.
Gaetan Dugas.
And he not only had friends at every port and call. And so he was having sex with people in San Francisco and Washington, D.C., and Chicago and Miami and New Orleans. And so that is how it all started.
He was apparently a very actually, I have a picture
handsome,
of him. Very handsome guy.
Very handsome. And it was first called GRID, 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 disease, infectious disease. I don't remember what the R was. First of all, I am not a medical provider. I am not a lawyer. I was a school teacher.
Sure. Right.
that worked for the Red Cross and taught about HIV and AIDS. And that became my passion. And then I came on to the board of the AIDS Action Coalition, and then eventually became AAC's first education person.
Right.
And then through a series of events became the executive director and now CEO.
Right. Yeah, and the other term was the 4 H's. It was like homo, Haitian, hemophiliac, and there was one other H.
Yeah, these are so. This is like 35 years ago.
Yeah. Well, I think, and I bring that up and you kind of just touched on it, right? So that was patient zero, Gay Tong, right? There was no funding because there was this huge stigma, no funding from the government to really say, hey, we need to get a handle on this. I believe the web you start going down this hole of trying to research this, and then the conspiracies start popping off, right? And just like the pandemic, did it start here? Did it start there? Where did it start? Is the government involved? And then there's some really crazy conspiracies that continue to sprawl
and
out.
not only that, did it start from a monkey? Did
Right.
it, all these things that we had to fight at the very beginning.
Right.
It's always been a human disease, and it's a virus, which we all know. Viruses, we don't have a cure for any virus. Viruses mutate and they change.
Sure.
And so that is why new medications are constantly, in the early years we had AZT and that was it. Then they realized that they needed, these other AZT plus. And then we finally, the drug companies, albeit they made a lot of money off of HIV and AIDS, but they also have done a remarkable job of making this now just a
chronic
disease, like heart disease.
Yeah.
Or, you do have to be careful from the standpoint that you want to make sure. Now we know that people who are undetectable and they don't have enough virus in their system, they take their medications correctly, consistently, they basically will not infect another person through sex. But that in itself, making sure that you keep up with those doctor's appointments and those lab appointments, and making sure that your lab results you're still undetectable, and maybe your virus has mutated a little bit and it needs a little tweak on another medication.
Yeah.
So it's not, let's say it's a chronic disease, but it's a chronic disease that you do need to pay attention to.
Yeah. So just let me set up this next question by just saying, the country's attention and President Reagan, who was in the second term, wasn't until Rock Hudson died that it seemed like, okay, now the funding shows up. Now the country's going to really start looking into this. This is a health, crisis.
Right.
And then that poor kid, Ryan White, and from Indiana, he gets it. He's 12, 13 years old, and never heard the end of it, right, from his classmates, et cetera, and all kinds of
He was
jokes.
actually he was not able to go to school.
Right. Yeah. He
They
ultimately
wouldn't let
dies.
him, and he ultimately dies. Before he died, he got the attention of Michael Jackson,
Elton John.
Yeah. He was, and let's face it, those stars, had LGBT roots and that kind of thing, and this little boy just really did catch the attention. He was a hemophiliac.
Yeah.
And it was prior to now. They screen the blood. It's actually, you're using. I can't
Sure.
speak medically what you're doing, but you're not going to get HIV now from receiving blood products.
Got it.
But he got the attention of Congress in Washington, D.C. And it was Senator Kennedy that really went to Jeannie White Ginder, his mother, after he passed, and said, we want to name the funding after your son. And I've met Jeannie White Ginder. She's even been here to Huntsville. She came for a fundraiser for us back in the early years, and she's a lovely person. She's getting up there, but she does show up at conferences and that kind of thing.
Yeah.
She said, I was just a mom. I wasn't a speaker. I wasn't a spokesperson. I wasn't but she became very, very passionate about helping. Then we had, like I said, Michael Jackson, Elton John, Elizabeth Taylor. There's still an Elizabeth Taylor Foundation, and have, come in contact with those people over the years. And the Elton John Foundation actually gave us the funds, AIDS Action Coalition, to have telehealth, telemedicine before it was even being used on a widespread like it is now.
Wow.
So it's.
So what was there someone in your life that you were close to that passed away from AIDS, or was it you had said you were teaching or working with the American Red Cross, or was it just you are one of those? Unfortunately, I think there's too many that they act when it gets very real for them, right?
I did not know anyone in my life, my personal life, but once I got involved with the AIDS Action Coalition, I've lost so many friends. And I've even told people that they were HIV positive, which makes it very real to you. I remember a young teen, a female, that her pediatrician, this is going to be kind of, I don't know if your listeners are going to be, this is going to be kind of graphic. Her pediatrician sent her over to us because he was concerned that she might have a lot of STDs. She was homeschooled, okay? She was homeschooled because her parents didn't want her to be,
right.
didn't want to affiliate with all the riffraff, quote, air quotes there. And she had gonorrhea of the throat so bad that she could not swallow her spit.
Oh.
And I tested her for HIV, and she was HIV negative. And I don't know how, because she had, just so many STDs. And I said to her,
how old was this child?
She was a teenager.
Okay.
She was probably 14 or 15.
Okay.
And obviously having unprotected sex. And I said, here's your opportunity to live your life from here on and to stay away from these things. And, she was so grateful. But, I mean, how do you do that?
Yeah.
How it's just very, very hard. The early years were very hard to tell people that they were HIV positive, because so many would go, well, where did I get it? I don't know. There, you got it from having unprotected sex or sharing needles with somebody that was infected. And like I said, we have lots of tools in the toolbox now that keeps people from getting HIV and AIDS.
Yeah.
It's not a death sentence anymore, and you don't have to get it.
Right.
Even if you have a lifestyle that you have sex with people, multiple people that you don't know what their status is. So there you go, Troy.
Okay, so we're in the 80s. It's 1988. That's when the coalition stands up. I was just giving a little bit of the federal or the national backdrop just to kind of paint that picture. Like, okay, well, now we're close to home here. Now we're in a city. At that same time, I'm assuming, having difficulties getting enough funding.
There wasn't any funding in '88.
Okay.
Our organization,
or there may have been for other parts of the country, just not here.
Oh, yes, the metropolitan areas:
San Francisco, New York,
Chicago, Washington D.C., New Orleans. They were all Atlanta. They were all getting the funding. We were getting no funding. In '88, the AIDS Action Coalition literally started out with a cigar box with donations in it.
Oh, wow.
In the back of a bar, which doesn't exist anymore. It was called the Vue Carré. It was called the Carré. It was called the Vue. It was anyways, two men who owned the bar, Boogie and Papa. I will never forget those two people, those two individuals. They actually stepped up, and it was just a group of friends that were, there was no organization. We did incorporate in 1988, and the people on that incorporation paperwork were people from the community that had some sort of an interest. And actually, a woman I go to church with, Barbara Myers, she was actually on the incorporated park paperwork, and she helped with National Children's Advocacy Center, I believe, but don't quote me on that.
Yeah.
She was an early person that helped.
Because that was only 4 years prior to that.
Yeah. So I came along in 92. Again, I had been working for the Red Cross as their health educator. And, you know, I was teaching basic first aid and CPR and babysitting and, you know, blah, blah, blah. But I was also teaching about HIV and AIDS. And it just became so apparent to me that this is where I needed to be. And so many things from back then. You know, we lived in Limestone County is in our service area. All the men that were incarcerated in the state, we could talk for hours, were housed, and I mean housed, at Limestone Correctional Facility. And they were in a big metal building with no air conditioning. They worked on the chain gang. I mean, there were just so many inequities that were happening. So I worked with the ACLU on trying to make sure that people that were incarcerated and had HIV and AIDS got the same, not benefits, but the same treatment as everyone else. On the weekends, they only got 2 meals a day. I mean, that's typical for you know, breakfast, a hearty breakfast, and dinner. Well, people in the early days had to take their medication with food, and that meant that they went without their medication for that noon meal. I mean, so many things that were just so unfair. And the Southern Poverty Law Center and the ACLU and a group of us were really trying to make sure that they got the same benefits as everyone else.
It reminded me, I was in my research, like some of the original scientists, right? There was no funding federally. What can we do? And it was a sad number. There was like less than 100, but let's say it was like 80 scientists. They just kind of band together, probably similar to the VU, the back room of a bar, and it was like a meager. They raised $8,000 amongst each other. Yeah. Not a lot of money.
Not a lot of money.
You know, and then, but from there, humble beginnings. Now, in 92, was the Magic Johnson, had that already come out?
No, Magic Johnson, I don't have the exact date, but I started with AIDS Action Coalition before Magic Johnson because I actually took a group of people down to see him at a church.
Really?
And I was already the education person at that time. So I had been on the board and then had been hired by AIDS Action Coalition. I've been with AIDS Action Coalition and Thrive for 26 years.
Right.
And then my prior experience was on the board.
So at what point does funding start pouring into Huntsville? And did Magic Johnson's situation now ramp up the amount of money available? Because now you have yet an even bigger star. Well,
it was hard because people started to say, well, gee, if Magic Johnson can get HIV, anybody can. You know, it did help. I have kind of a funny story, and you'll probably have to cut some of these stories out. I was up in Washington, and I was at a congressional hearing, and Senator Kennedy was there. And he, they had their chosen people.
This is Ted Kennedy, right?
Ted Kennedy.
Okay.
They had their chosen people that were going to speak to the hearing. And I was one of the people standing against the wall. And they said, does anybody else have any comments? And I raised my hand, and everybody looked at me like, what is she going to say? What is she going to talk about? And I said, I have an issue. I said, I have no funding, and we have a big problem. We don't have enough money to take care of these people. We don't have what they call Part A funding that went to those large metropolitan cities. And I said, I went into all these statistics, babbling out of my mouth, And finally I said, I guess I could go to my state health department and I could beg. And just like this, there was a dramatic pause. And Senator Kennedy said, you shouldn't have to beg. I thought, I'm getting a chill just now, just thinking about that conversation. So it's been those kinds of opportunities. And I'll give a teaser. We are going to talk about my Elton John story later on that you don't even know.
Yeah, I bet. I don't know all these stories.
Anyway, and that's about the time that we started getting money from the state health department. $25,000 was the very first amount we ever got. I will say that the state health department, through federal funds, Thrive Alabama receives nearly $2 million a year.
Okay.
Now in funding. Our funding is very broad because, and this kind of gets into why we became Thrive and why we are where we are today. It was very difficult to increase our funding. When I started out, we had 198 clients, and we have between 1,050 patients at any one given time who are living with HIV today. So with no new money, you had what you had when we had 198 clients. Now we have 10 times that, and there's no new funding. So what do? So what I did, with the help of my amazing staff, we wrote grants. And today we operate on about 30 grants, and there are a wide range of services such as mental health, behavioral health. We now take care of people, babies all the way up to the elderly, who are not infected with HIV. We have federal funding called Federally Qualified Health Center, or CHC, Community Health Center. We are the safety net. There's 1,400 of us around the country. And here in Alabama, we have 19 federally qualified health centers. We are taking care of people that no one else wants to take care of. Very similar to where we started out with HIV and AIDS. So people who have insurance, who can't find, and we'll talk more about this, who can't find a provider. We have people who are on Medicare. We have people that are on Medicaid. And then we have the people who don't have any insurance whatsoever and who either go without or they show up in the emergency rooms here in our city. And that kind of care is not... My granddaughter, a couple of weeks ago, had a breathing emergency. She needed to be in the emergency room. Some went to the emergency room in an ambulance. People who are there for a sore throat should not, or a cold, should not be at the emergency room. Right. They should be seeing their primary care physician. But if you don't have insurance, what do? You go to an urgent care. You go to an urgent care, and I'm not knocking urgent cares. They serve a purpose. But I'll tell you what I do. If I have kind of worked all week, 8 to 10 hours a day, 12 hours a day, I don't go to my primary care physician. I'm sorry, Darla. I'll wait and go to an urgent care on the weekend. And what I'll do is I'll go to the one that I go to. And then I'll go, and it's got a parking lot full of people. So I'll go to a different urgent care. Oh, they only have 2 cars in the parking lot. I'll go to that one because I can get seen quicker. So those urgent cares do not have your primary care notes. They don't know what you've been taking. They don't know what your and when you're hurting because you want to be in an urgent care, do you remember all those things?
Yeah.
Do you give your whole health history? And so that is why we need to be helpful in this community. And we'll talk about that.
This is a somewhat off topic, but is malpractice higher for urgent care?
I have no idea.
I was just kind of thinking.
I have no idea.
You would think it would have to be.
It's usually by disease, what your specialty is.
Yeah.
So OBGYNs have the highest, malpractice insurance. I don't know that it goes by the type of clinic that you are.
Well,
I'm
there's like
not familiar.
Just like you said, you don't have the notes. The person might be able to detail something to you. We all get tired of filling out forms. Sometimes it's like, have you ever had one of these 500 things?
Yeah.
And you might miss something because you're just like, I'm so tired of filling out forms.
Right. And the thing is that I've been at urgent cares and have experienced someone walking in and the urgent care will say, it'll be $150. Do you want to pay cash or credit card? And that person will pull that money out of their pocket. And I want to say, here's my card. Yeah. We'll see you.
Yeah.
Regardless, on a sliding fee scale, we might charge you $20. Yeah. We might charge you, our nominal fee is $30. That's what we would charge you to be seen today. And you could have a primary care physician, but it's very difficult to see that happening in real life.
So when did the transition, walk me through what was going on when Thrive was going to become Thrive.
Okay.
And I know that might be more recent than we had thought, like 2015, I think.
19. Very recent.
2019. Okay. But let's ask a different question. At what point were the people you were treating, it was no longer just about AIDS, HIV?
Yeah.
Let's if you can bring me back to that point in time and what was going on.
Absolutely. So, like I said, the funding was scarce. And we needed to be able to take care of our population that we had started out with, but we didn't have the money to do that. So we started looking for grants, and I started thinking
federal and state,
state, anything from people out in Research Park. I mean, we take donations. We are a 501c3. So,
what about the World Health Organization? Do they?
World Health Organization is global.
Okay,
that is global, but does not give money back to the United States. And actually, the World Health Organization is more of a research kind of facility.
Gotcha.
So in 2015, we changed our name to Thrive Alabama. We wanted to be, number one, more inclusive. We wanted to kind of shy away from the AIDS Action Coalition because, let's face it, who wants to bring your children to an AIDS clinic? Mm-hmm. That was hard. So we were still taking care of people living with HIV. But think about this. If they're walking into the health to Thrive Alabama, they are no longer walking into the AIDS Action Coalition. It did a lot to reduce stigma.
Right.
And people came to our clinic, even that were HIV positive, because they no longer were afraid to come in or want to be coming in back door.
Yeah.
I'm being very serious. So,
but were people coming even in the 90s that didn't have AIDS-related stuff? So it wasn't until really It wasn't really until between 2015 and 2017. Okay.
We started as a pilot project taking care of people that were not HIV positive. They might have been family members, that kind of thing, so that we could show the federal government. We became a look-alike in 2018. And a look-alike meant you had to do everything that you have to do for a CHC, but you got no funding.
Yeah.
So, this came again from donations and, indirect funding and that kind of thing. So by 2019, early in 2019, we wrote a very difficult grant. We were up against hundreds of people across the country, hundreds of organizations. And what we did was we got literally a text, "You've been selected."
Wow.
And it was September. I'll never forget, because there's lots of reasons to not forget September the 11th. But it was September the 11th, 2019, that we found out that we were going to be a federally qualified health center. We had no idea how much work it was. It was very, very competitive. There were only 25 clinics designated in 2019, and there haven't been any new clinics designated since then. So,
do you still have the text?
Oh,
the screenshot?
Probably, because I'm really bad. My family is going to laugh at this. They know my technology is maybe one. I probably do.
That's all right.
Anyway, but what happened was then in 2019, towards the end of the year, November, we started talking, or we had been talking about needing an additional, a larger facility to take care of people that we needed to take care of. And then, of course, January, February, and March of 2020,
Right.
The whole world fell apart.
Right.
At that time, we've been talking with Huntsville Hospital officials since the very beginning. They've known about us. They refer people to us, out of their clinics, that kind of thing. They called us and said, hey, can you help us with some COVID testing drive-thrus? They knew at that time we had a big RV that was outfitted as an exam room, and we use it, for testing and for going to events and that kind of thing. And someday I hope that we can help homeless healthcare with our vehicle. Looking for another grant.
Yeah.
Anyway, so we helped out Huntsville Hospital for probably 18 months. And then what we realized was there were a lot of people who were not coming to Joe Davis parking lot, Joe Davis Stadium, John Hunt Park. They weren't coming down there. So we actually took our unit and went to mostly churches in North Huntsville. We'd go to the pastor and we'd say, do you have people in your congregation that can't get to the drive-thrus? And they said, absolutely. And we said, then we'll come to you. And usually the pastor would help us. They would get tested first and show that it was, and it worked out beautifully. We reached a lot of people. And we were actually given funding to do that testing and to keep our staff on board and to make sure and to do telehealth, all those things that we had to do during COVID that everybody had to do.
You just brought up Joe Davis. We look at the screen. This is a slide from
my presentation.
Your presentation, and I think this is an important part to say, okay, this is not the Mayor Joe Davis, for which Joe Davis Stadium is named after.
Right.
Well, there was that. Your mobile unit was parked there. But then also the name Joe Davis is important for the clinic.
It was very...
And there's this picture. Can you talk
there's
about
his
that?
picture. So Joe Davis, this young man, he worked at Quality Quick Print on Governor's Drive. We still use Quality Quick Print today. He worked there, and he was living with HIV and AIDS. And when he passed away, unbeknownst to us, he left us an insurance policy that he had taken out, whenever, a $25,000 insurance policy. And that we started out with our clinic being called the Joe Davis Clinic.
Okay.
And, we're thankful to him today that he helped us with that small amount of money to make a clinic that we could see people.
Yeah.
And our clinic started out at the health department on Green and Eustis, which that health department doesn't exist anymore. It's now a parking lot and a green space where Church of the Nativity does their Green Street Market. We had to carry our patients up the back stairs because there was no elevator. I mean, these are horrific times.
Yeah.
And we were seeing our patients, thank goodness, out of the Madison County Health Department.
Yeah. Now, you take over as when you became the CEO, and that was 26 years ago.
I was first an education person, and so I would go into high schools and talk about HIV and AIDS, and I ran a youth program where they would get trained on HIV and they would talk to their peers. It was a lot of fun. Took them to conferences, gave lots of education. They handed out condoms to their friends, and
so you were doing outreach.
I was
training,
doing outreach training. We had 5 employees at that time.
What year was this?
And that was 97.
Okay.
96. Yeah. And what we did at that point, or what I did at that point, was that our executive director passed away, and I became the interim director. And then as I became the director, I saw that I could make a big difference to a wider group of people by writing grants and seeing, what we needed to do next. And I guess started my visionary planning of what I wanted us to be when we grew up. And then I became CEO. Actually, I don't remember exactly what year it was, but I hired mid-level directors to help me out. We had an operations person, a finance person, a clinical person, and an executive director, and then I was CEO.
So, and that was 99, I believe.
It was that was well into the 2000s, well into it.
But at some point, what I'm getting at is you take the budget from 500,000 to about 10 million plus to what it is now.
Mm-hmm.
Walk me through, and was it just a matter of, was it grants, outreach, education, marketing, promotion, continuing to hire the right people? Like, walk me through some of those things where, like, okay, Marr, am going to help take the clinic at the time to another level. How did you do
it
that?
was grants. It was a lot of grants. My kids, who are now 40, 37, and 32, hated grant writing time because I spent a lot of hours at the office. You didn't have a computer at your house. You didn't have a laptop.
Right.
So, my kids were very patient and I was a single mom ever since my daughter, who's 32, was 5.
Wow.
So they were very, very patient. And Morgan sat in my office a lot as the littlest one. And so you write grants, you start charging insurance, getting what they call program income, and that is basically not restrictive. You can do whatever you need to do with that money. We're just putting it back into the organization. I very often say the people with insurance help pay for the people without insurance. And that makes sense. It makes sense. Hiring the right people. Oh my gosh, we have had so many amazing staff members over the years that would take us to a next level. And then we have some who, Heath Nicholas has been our director of case management. He started out as an intern from A&M.
Wow.
I mean, you see people who shine and who are dedicated and passionate, and you just keep working it. The reason we have a $34 million organization now.
Oh, wow. It's gone that high.
It's gone that high. This year, it's up over 33 million. Is because I kept, looking for how can we do this? How can we do this? And there's a program, a federal program called 340B, which I will not. I would have to. That's where I was in St. Louis, was at a conference about 340B, and I was speaking at it.
Last week or this week?
This week.
This week. Okay.
Got back yesterday. So
that's a drug pricing program, right? The 340B drug pricing program?
Yes, thank you.
Yeah, no problem.
Absolutely. So people can go and read all about it, but we have basically contract pharmacies that work with us. Walgreens, CVS Specialty, Accredo, Walmart, Publix, Walgreens. I don't know if I said Walgreens. And then 2 private ones called Avita and Courant. And we are able, because we are one of these entities, we are able to purchase drugs at 40% of the insurers, with the price of the drug, what the insurance company is going to pay. And then we have our clients use one of our contract pharmacies, And what happens then, there's some management fees and stocking fees and those kinds of things. But then at the end of the day, if it's $1,000 drug, we get to charge $1,000 for it to the insurance company. So we get like $450 back.
Nice.
Now, some of our medications, our HIV medications, are $3,000 a month. So you can imagine that adds up very quickly. And people cannot just, I don't have the money for it this month. So we have programs. What the federal government wants us to do with our residuals, our cost savings of this 340B program is to put that back into our program, and it doesn't cost the federal government one dime. The American people don't pay for it. Insurance companies pay for it, which you can imagine they don't like that now. Pharmaceutical companies, insurance companies, wholesalers, we work with all those people, and they're kind of fighting us in Congress right now. Unfortunately, I have to spend way too much time out of the office, either fighting for what's right. The South is still the number one place that we have more people infected with HIV and AIDS that are getting infected now than any other place in the country. Think about that. So the southern states are, and it's because people come home to be with loved ones. Maybe there's not as much education. There's a lot of poverty in the South, traditionally across the South. And so I go to Washington and I advocate for Ryan White, advocate for the 340B program, advocate for, you notice I didn't say lobby.
Advocate. Yeah.
I advocate for poverty in the South, for health care, advocate for all those things. And, a lot of people think, you go to Washington and you'll go to Strong's office or Tuberville's office, or even the Tennessee offices, Katie Britt's office. You'll go one time a year. No. You have to be up there constantly, making telephone calls to them constantly when something's coming up. Hey, did you see that article in the Huntsville Times? Those kinds of things all the time, because the squeaky wheel, unfortunately,
is constant. So not even just quarterly. You're saying
not even. Now, during COVID, I didn't go at all. We did it all through Zoom.
Yeah.
But there's nothing like sitting across from somebody and telling a story, or taking someone HIV positive with us to Washington.
Are those in the South? Is it still just through unprotected sex? Is that the primary?
It is primary, but we do have counties in Alabama that are in my service area. So we cover Mississippi to Georgia and Tennessee down to Birmingham. So there are counties over in the western part of the state who are on the 200 top counties in the country that have serious drug abuse problems.
Gotcha.
So, can get it from needle sharing, can also get it from, if you're high on meth, you maybe don't think about protecting yourself when you're having sex with someone.
Yeah.
And you're having sex with someone who has had sex with multiple people. I'm not being judgmental at all, because we take care of all of these people. But it's just, we want you to reduce your risk.
Yeah. We were just, I was in Wyoming with my son. Driving out to Idaho, take him to school, and we just went into like a diner in Rock Springs, Wyoming. And the lady's like, "You guys aren't from here, are you?" And we're like, "No." She's like, "Oh yeah, because this is like the meth capital of the world. So everyone who comes in, they just know. They can just tell between the locals and those passing through just on what drugs is done." And I'm like, "Really?" Like, you kind of look around and it's, I don't know.
It's so sad.
You're just like, well, unfortunately, I feel like I've heard that many, many times. You visit different places. Oh, this is the meth capital of the world. Like, well, it's everywhere.
It's everywhere.
And it's unfortunate that those who live in a particular town or city feel that way, that it's the meth capital of the world. It's just,
So we needed behavioral health for our clients. for our HIV positive clients. So we're in our third round of SAMHSA funding to take care of people. It started out taking behavioral health, mental health, and substance abuse programs for our HIV positive patients.
Mm-hmm.
Now we take anyone, and I keep saying this, when we get our new building, which we're going to maybe show a picture of at some point, we will be all under one roof, and we will be able to exponentially increase the amount of services that we can provide. Right now, we're landlocked. We're at UAB for our adult medicine.
Mm-hmm.
We are on the Parkway for our pediatric. We just had to move. We are over by Church Street by Mason-Dixon for our behavioral health. Our education is out at Mid-City. Our admin is on Governor's Drive at the Parkway behind Scooters.
Mm-hmm.
So that causes all kinds of problems for our clients and for our staff, trying to feel like you're one organization. We also have a satellite site out in Florence and one in Albertville. So we have 120 staff, 115 staff, I think, today, that are spread amongst all these different places. And we try to take care of the whole patient. So that patient may have a need
Mm-hmm.
to go to behavioral health, and they have to go somewhere else. So we're trying to get all of our services under one roof. And once we build this building, we will be able to see about 22,000 people on a yearly basis just with daytime clinics. Right now, we can't have any evening clinics because of where we're located. We will have evening clinics, Saturday clinics at some point when the need is there,
Mm-hmm.
when we're filled up at 22,000 unduplicated patients a year. We will also have dental and vision. People who don't have money for healthcare also don't have money for dental, and they don't have. Some people have never had their eyes tested.
Yeah.
And those maladies of needing dental care and needing vision care can also affect your primary care.
Mm-hmm.
So, and a mom who can only take off one day will be able to work her. She'll be able to be seen. Her kids will be able to be seen. Maybe they'll get their teeth cleaned that afternoon, all in one day, and be in one place. And this is so needed. I tell everybody that I can think of, healthcare, and I say this at City Council, I say this to the mayor. Mayor is coming to do a walkthrough of our new pediatric clinic this afternoon. I say it all the time. Healthcare is infrastructure. It is just as important as the roads. It's just as important as all these apartment buildings that we're building. If people are coming to Huntsville to get a job at a rate of 45 people a day, and I take that statistic off of the Chamber of Commerce website,
Mm-hmm.
about 7,000 people a year come new to Huntsville, and they can't find a physician. I brought in this morning, there was an AL.com or Huntsville Lead article yesterday that said, looking for a doctor in Huntsville, you'll probably have to wait. People with insurance can't find primary care. People with insurance can't find pediatric care. And we are to the point where we don't have a lot of space to take new people. We need that big building to go from, I got the statistic yesterday, we have 9 exam rooms for pediatrics and we have 12 exam rooms for adult medicine. Our adult medicine, those physicians, providers, nurse practitioners are doing each provider has 2 exam rooms. You really need 3 so that you can move people through in a timely manner. We are at our new location on the Parkway, 3007 South Memorial Parkway. We will be able to hire an additional pediatrician, and we're looking for that person now.
What do you feel is the contributing to the lack of attention or the lack of support Is it because there are too many things going on, too many dollars being asked for many good things? Then, well, I guess it's relative is what's good or not, right?
It's all relative. And again, I mean, I know that I walk around acting like a banshee, telling everybody that I know that you need health care.
Mm-hmm.
My daughter laughs at me because we'll go to a restaurant, the service industry, your waiters, your waitresses, your bartenders, they do not have insurance. They just do not. And I am really bad about saying to our waitress, "Do you have health care? Do you have a place to go?" "Oh, no, I go to urgent care, or I'll go to I'll go to the emergency room." Take my card. Look us up. Fill out the paperwork online. I can't afford your health care. "Oh, yes, you can. We see people on a sliding fee scale. We turn no one away." Now, it may take a little while for you to get in because of the fact that we're in constant trying to bring new people in, but ultimately we will be able to see you.
Yeah.
I belong to a lot of organizations, and one of them is called Women for Good, and it's like a group of women who put money in, and then nonprofits they put their organizations out there, and once a quarter we give a grant to somebody.
Yeah.
And last week I was at our meeting, and there was an organization, and I'm not going to remember what the name of it was. Kylie's Project. Anyway, it was a young couple who lost their child and in the hospital during COVID. Nobody was allowed to come up. Her mother wasn't allowed to come up and console her.
Yeah.
And she has started an organization for people who, in the Huntsville community, that lose a child, or even a child up to the age of 2, I think it is. And they are just an amazing group.
Yeah.
That they're building a memory garden at a Methodist church over off of Drake. It's I'm embarrassed that I can't think of what the name of the organization is, but people should check these things out. There are lots of opportunities in Huntsville for people to find help.
Let's talk about the facility again. Mm-hmm. And I want you to, we're going to talk about a couple slides here, and one is funding it. I know that you got a big $1 million donation from the Porch Creek Indians.
We did. We're very proud about that.
If you could talk
Worked
about that.
on it for about 3 years. They are an incredibly generous group of people.
They're the only recognized tribe in Alabama. Is that correct?
Absolutely. We do have indigenous individuals that live in North Alabama, but they are not part of the Porch Creek community. And if you go down there, the actual Porch Creek community, they have a wonderful healthcare facility. So I was able to basically, show similarities for what we need and what they had. And I received a $1 million donation, and I'm trying to work off of that to finish I need to raise $8 to $10 million in order for us to break ground. We have some ability, and we're getting help from banks here in Huntsville, where we get what they call new market tax credits. Community economic development entities are able to get a larger tax break by helping, and it's very competitive. Everything's always competitive. Mm-hmm. By helping organizations that are going to put their programs into underserved areas. So our new building is going to be at the corner of Oakwood and Washington Street. It's a 13.5 acre plot of land that used to be the stockyards here in Huntsville back in the day. And we bought it. We own it. We've raised a little over $3 million. I need to get to 8 to 10. Mm-hmm. We're going to be able to once I can break ground. First of all, the cost of the building, it will go up no more. Number one. Number two, we can hopefully get these new market tax credits that will allow us to put about $7 million into our organization. We pay the interest for 7 years, and then we are relieved of the loan. The community development entities have basically paid the principal on that loan. So, and they get a larger tax break for it. So we're working really hard to make that happen. We also need some large donations from some people we're trying to be very creative. We're trying to look for some opioid settlement money, because we do take care of people living that are have opioid crisis problems. And then we hope to get some funds from some ARPA money that's still in our community. So that will be approximately $4 million. And then I have an appointment to meet with the governor's chief of staff in 2 weeks. And I'm asking the state legislature, Rex Reynolds, Arthur Orr, I've been to see all of them.
Yeah.
And but I've gotten as far as the governor's office, and I'll be talking to her about our need here in Huntsville.
And you've met Governor Ivey before?
I have met her at events, and I'm a part of the downtown Rotary, and she came and spoke with, and I've got a chance to speak to her for a few moments.
But this will be your first.
This will be my, and I'm first speaking to the chief of staff,
Sure.
so I have to get to chief of staff and then
to her.
Hopefully to her.